Hello, everyone. Nice to see you. I'm excited to present today and talk to you about my work in family-centered care. Well, let me tell you a little bit about me. My name's Beth Stormshak. I'm a professor at the University of Oregon, where I've been for a really, really long time, actually since 1996 now, so 27 years. I'm starting my 28th year at the U of O, and I've really enjoyed being there. I'm originally from Corvallis, Oregon, so I'm just born and raised here. I love the state of Oregon. I love working in the state of Oregon, so that's partly what's kept me here. I'm going to talk to you a little bit about my research I've been doing for a long time in the state, a lot of it here in Portland, and a lot of it in our rural area and outlying areas of Oregon. So we're going to learn about that and talk about ways to apply that to working with families and kids in community settings. I have lots of contributors that have helped over the years, a whole team of folks that work really closely with me and have really made this research possible that live here in Portland and have worked out of the White Stag building for a long time. Of course, now they're mostly working out of their homes as we had a huge shift during COVID-19, but they'll be moving to our new campus on the east side of Portland. And people that have helped facilitate our research, and including the Portland Public Schools that have been involved in a lot of our work initially, and I'm going to tell you about that a little bit today. And these are my kids. They're also contributors. They're older now. They've graduated. One's a senior in college. One's graduated from college. But they certainly helped me along the way develop all these models and ways of thinking, because there's nothing better than being a parent to figure out how to teach parenting skills, right? Or to learn that you don't know what you're doing, which in the case of having children is part of it. So today I'm going to talk to you about a model called the family checkup. Now first, let me see if anybody's heard of the family checkup. Yay, okay. We've got some people who've heard of it. That's fantastic. I would expect that you would have heard of it because we've been doing this work in the state now for about 25 years, and so lots of people have been involved. Now let me ask you this question. Have any of you been involved in the family checkup research, either as a contributor or in it? You have. How have you been involved? So you got trained in the model and implemented it? Fantastic, okay. That was my grant, I remember that. That was a grant we had focused on working directly with providers in the community and then helping scale up the family checkup at Morrison and Trillium and one other place, which I can't remember, but fantastic, okay. But nobody's been in any of the research projects. Sometimes when I speak in Portland, someone will say, my parents were in the project. Nobody in that situation? Okay. The reason I ask that is because actually the original work that started on the family checkup occurred here as a partnership with Portland Public Schools, and that started in 1995. 1,000 middle school kids were enrolled at that time, and half of those kids received the family checkup and their parents received that support, and half got school as usual. And we ended up following those kids and families all the way into their 30s. And so a lot of our long-term outcomes on the model are really based on the work that we did here originally in Portland. Then starting around 2005, we went back into the Portland Public Schools and we recruited another cohort of 600 middle schoolers. We adapted the model at that time, and we did the same thing, and we followed those kids and families into their mid-20s. So when we talk about a lot of our long-term outcomes of the family checkup, those are with populations right here in Portland, so that's kind of exciting. And I'll tell you a little bit more about that in a bit. So over the years, the family checkup research has been funded by a lot of different federal agencies, the Department of Education, a lot of National Institute on Drug Use funding. That's probably our primary funding. Grants from the CDC, the grant you raised your hand in the back and said you were involved in, that was funded by the Centers for Disease Control. And the NICHD, which is National Center on Child Health and Human Development. So lots of different funding agencies have been participating in our work over the years. And thousands, like I said, of families in a lot of different clinical trials across both urban and rural areas of the country, with culturally, socioeconomically diverse families and international families in many different service settings. So at this point, the family checkup has actually been tested in a lot of community settings like Morrison Center, as well as a lot of schools, early childhood centers, high schools, pediatric settings, and a variety of other community settings that we'll talk about as we move forward. So there's the family checkup can be adapted to different community settings. So, like I discussed, we started our original research here in Portland. First projects were here in the Portland Public Schools with 1,000 youth and families. And we followed those folks for a long time. And we found some pretty substantial impacts of that middle school intervention, including decreased substance use and substance abuse into the adult years when compared to the group that did not get the intervention. Decreased rates of delinquency and arrest rates, and that was using arrest data collected by the county. Improved grades and attendance in high school from the middle school intervention. And I have a colleague right now who is looking at decreased depression and risk for suicidality all the way into the adult years with our family checkup data. And he's taking data sets from across the country that have implemented the family checkup and looking at these long-term adult outcomes and really finding significance even 10 years out from the intervention for decreased levels of depression and a decreased risk for suicidality. So there's some pretty powerful outcomes that come from this very brief intervention, which is really interesting. So what we're going to think about today, and I'm really excited to also hear your feedback, is how is it that we can do a brief intervention at this critical time period, middle school, which we all recognize is a critical time period, right? Whether you like it or don't like it, you recognize something's going on in middle school and we need to do something about it. And how can we deliver a brief intervention at that time period and get kids on a different trajectory? So that's what we're going to ponder today and think about. So that kind of summarizes some of our long-term research, but we've created this figure to kind of give you a sense of some of the work we've published over the years now on the family checkup outcomes. We look at direct targets of the intervention, which I have up here, like parenting skills, positive parenting, supervision and monitoring, family routines in the home, and we have publications that look at impacts on all of those, what we call sort of direct targets or proximal targets. We think, this is kind of our theoretical model, that when we target those types of family skills and family relationships, we see some secondary effects of that, including children's self-regulation, involvement in school, reductions in family conflict, improvements in parent depression, and improvements in parent self-efficacy, or feelings like they can be a good parent and they can interact with their child in a way that's useful and helpful. So we found effects on all of those things. And then long-term, we followed kids into the adult years, and I won't read this long list, but we basically have outcomes on all of these outcomes, including into the lifetime kind of adjustment of healthy adult adjustment and reduced arrest rates and reduced adult alcohol abuse and improved mental health and wellness. So these are some of the impacts we've seen over the years. The family checkup's recognized now as a model by several different entities, including the Title IV Prevention Clearinghouse, and we've been partnering with communities all over the country to draw down those funds and be able to implement the family checkup in community settings with kids who meet criteria for those funds. National Institute of Justice, Blueprints, NREP, and Administration for Children and Families, so has recognized it as evidence-based. So what's exciting about where the research is right now with the family checkup is it's really moving toward a large-scale implementation. And that's what's exciting to me at this point in my career, because I've been working with the model for so long and done so many research studies on it. And now what's interesting to me is, well, how do we get the model out to communities? And how do we train community providers like you and your colleagues in working with the model and implementing it in a way that's meaningful to providers and families and communities and kids? And so that's kind of what I'm studying now and what I'm interested in learning. And of course, those are different research models. Those models involve talking with all of you, interviewing you, looking at how the model is rolled out in different settings and understanding uptake and what it takes to train providers and to sustain it. And so those are some of the things I'm interested in. I have this spin-out company called Northwest Prevention Science that works closely with the University of Oregon. And what we're doing is implementing it all over the country. And you can see on this map, these blue dots represent all of the community settings implementing the family checkup right now, getting trained in it and implementing it with children and families in their various settings. So we're working closely with all of these groups to look at how that rollout is going. And I'm excited to report that over time as I get more data on that. This is work that's kind of just beginning for me. So let's talk a little bit about the model. I know some of you raised your hand and said you were familiar with it, so I'll just give you a little rundown of what the model is. The family checkup really is a 3-step model. that involves an initial interview or get to know you interview or welcome interview, or a lot of groups now call it all different things, and you can tailor the name of it to your community and your setting. It then involves a child and family assessment that's norm referenced and provides feedback for families on strengths, things they're doing really well, and areas of growth. And there's a feedback session that's then delivered by the provider that uses motivational interviewing and a strength-based approach to really zero in on things that families are doing really well with their kids and ways that they can grow and impact their child's development. And that's really when we train providers, the crux of the training is around delivering the feedback and helping to jumpstart parents into motivating them to maybe make changes in the way they're thinking about their interactions with their child and think about ways to improve their child's success and future. So that's kind of the model in a nutshell. The theory of change is really focused on parenting, family relationships, and things that happen at home. I mean, our model is a real sort of family-centered approach to helping families get along better and build trusting relationships with their children. And our research over the years shows that when we do that, we have improved child outcomes. Families are many times the trusted source for their child, and so improving those relationships can make a big difference for kids. So over the years, as I said, we've had many different target populations. The family checkup is typically delivered with families who have children ages 2 to 17. So we have an early childhood model that's obviously a little bit different in scope and in assessment and what we do than at a model that we would deliver at age 17, hopefully, right? But the model is tailored to those ages. It's typically delivered to caregivers. So it doesn't have a real child focus or child component. It is a parent model. So it's the parent that participates in the intervention. So children need to be living with some sort of caretaker. All caretakers that are part of the child's circle of caretaking can be included. So it doesn't matter who a child's living with or who their caretaker is, and we include everyone that's involved. So we've definitely implemented the family checkup with, say, aunts and grandparents and whoever's in that caretaking role. The model, it can be used as a prevention-oriented model, which is a lot of the work that we did here in Portland in the middle schools. That was very prevention-focused, but it can also be used as an intervention with families that are in crisis or struggling and need support. It's been used across rural and urban settings, and it's appropriate for a very broad range of kids and services in the community. This is just a little information about kind of what it looks like. It's typically a 3-session intervention that involves, like I said, initial interview, assessment, and feedback. And then at the feedback session, people can choose to follow up with a menu of options, and that's kind of following with a motivational interviewing type framework. The options typically involve different parent skills or ways of interacting with their child that are drawn from a curriculum that we have that goes along with it called the Everyday Parenting Program. So the direct service delivery typically involves 3 to 4 hours, and the process takes 4 to 5 weeks. And then someone might engage in follow-up sessions in the Everyday Parenting curriculum that average 3 to 4 different hours of service contacts. So there's some prep time, like 1 to 1.5 hours prepping for the feedback session, and 10 to 20 minutes of prep for each session. But in a nutshell, that's typically what it takes for providers to do the model. And it can be delivered across a variety of settings, as we discussed. I think that's pretty much all I want to say about that. So some key principles of the family checkup. It is an assessment-driven and tailored approach, so it's an adaptive framework, and the services are tailored to families' needs and goals and social and cultural contexts. I think this is one of the most unique features of the family checkup, and maybe also one of the most frustrating for providers and people that want to train in it, because people are always asking us, well, what exactly are the parents going to do? And there are certain steps that everyone goes through. But then the model is very tailored and individualized, which is a strength of the model, but also it's hard to put it in a box and say, every parent's going to get this dosage and they're going to get this content. Because once they get through the feedback session, the content varies on people's strengths and where they're at. And if you work with families, you can think about how that looks. I mean, you may have a parent that is really great at praising and being positive with their child, and they do a fantastic job of that. But they really struggle with limit setting or setting rules, and they don't have a clear bedtime or clear structure at home, and that's an area of growth. And then you can probably picture in your mind the opposite, a parent who has all these rules and structure in the home, but is really struggling to have that positive connection with their child or use praise and support or incentives. Those two parents would come through the family checkup model, and they would get feedback on the great strengths that they have in those different areas, and then they would think about the areas of growth, and they may then move into some content that's completely different. Parent A would get some content that is really focused on limit setting, and parent B would get the content really focused on praise and support. And so the model then is tailored and adapted to each one of those parent strengths, and that's what makes the model unique. It's motivational, so I bet a lot of you are trained in motivational interviewing. Who's trained in motivational interviewing here? Yeah, that's so great. I mean, there were time period, even 10 years ago, when I would ask that, and people were just beginning to be trained, but I think it's fantastic that now that's pretty much something everybody has training on, and I think it's a really powerful skill. And that's one of the sort of skills that goes along with delivering the family checkup. It's strength-based, as we discussed, and it's really focused on areas of resilience as a foundation for change. A lot of parents that we've worked with over the years have told us, so many times when they've gone in for help for their child, they're blamed, or they feel like they're to blame. They've had a negative experience with the schools or community settings or healthcare. And this model kind of tries to turn that around a bit by focusing on what people are doing well and starting there as a foundation. And we have a lot of parents that tell us, this is the first time I felt like, I do know what I'm doing. I can do this. So it's a really positive model. It really treats parents as experts, because they are. Parents are the experts in their child, and they know what works for their child and what doesn't, and so it really empowers them to have that role in their family. It takes a collaborative set, so it focuses a provider and a caregiver on having collaboration toward a process of change. And it's a health maintenance model. It's well-positioned to be delivered annually, or in a lot of projects that we've done, we use it to check back in with families and do a recheck, a re-family checkup, and then look at how people were doing the year before and how they're doing now and compare their growth. So it can be used in that kind of way as well. The family checkup is also a culturally responsive model. It's really about relationships and connection. And empowerment and autonomy. It's unique in that there's equal power balance in the relationship that you create with a provider and a parent. It's sensitive to context and cultural factors, which are really key to conceptualizing the family. So if someone's struggling or has values around parenting that are discrepant from someone else's, that can be dealt with in the model and supported. It's really supportive of people's parenting values and their culture and how they want to use those their cultural values and how they interact with their child. Cultural humility is part of the model. We don't assume we know about other people's cultural experiences. And we have strong effects across a range of diverse populations on the family checkup, because the model can be adapted to a variety of populations. And then people always ask me this now. Of course, back in 1995-6, when this model was developed, we really didn't talk about trauma-informed care. That's something that's emerged in the literature and in the way we think about treating families and children over the past, I'd say 10 years even. And so we never used that language when we developed the family checkup, but the family checkup is definitely something that fits within a trauma-informed care approach. It has a real focus on positive parenting as a key strategy to prevent child abuse and neglect. And so it protects against those kind of risk factors that can interfere with a caregiver's capacity to parent effectively, and it disrupts the conflictual caregiver-child interactions that lead to neglect and maltreatment. One of the biggest sort of pieces of trauma-informed care is really focusing on trusted relationships and supporting positive relationships for people in families and schools. And in that way, the family checkup is a trauma-informed model because we're really focusing on supporting those trusted relationships in the home and building on those as a source of support and resilience for kids and families. So that kind of gives you a big picture overview. I'm going to move in now to talk a little bit about a variation of the model that we developed right before COVID-19 with the online approach. But first, let me take any kind of questions about that before I move forward. Does anybody have any thoughts or questions?
Hi, I just wanted to comment on the use of follow-up, and I just really appreciate that because I think that's something in substance use that we are constantly neglecting, is that they are okay for a certain amount of treatment, and it's been very hard to reach out in 6 months or a year or however long that they still need it. Yeah.
Good comment. Yeah, wouldn't it be great if our model for mental health treatment was structured more like our pediatric model in this country, which is, well, you bring your kids in for a well check, right? And when you're a parent with a young child, you really try to stay on that schedule, or we try to get people on that schedule, but we don't do it for mental health, and we have so many families that could benefit from a well check, right?
I was just going to add on to that I'm a family doctor, and that it feels like it would make sense if at our well child visits we're paired with we have in-house behaviorists that work with us that are integrated. If we had like a shared model where like part of the visit was us and part of it was with them to do these assessments just routinely for everyone for their well visit. These are designed mostly for like psychologists or who would normally be doing these.
Well, that's actually kind of the beauty of it. You know, when we first developed it, we've come so far since the beginning, you know, like you do in research. There was this huge, long assessment package. It was very focused on psychologists being the deliverers. And we've moved so far from that now. Actually, the assessment package now is super brief. It's about 20 minutes, so it can be completed in an office waiting room. And we have trained every kind of provider on the family checkup now. We've really made it something that can be delivered broadly in community settings. So we've trained a lot of bachelor's level providers. We've trained a lot of master's level providers, a lot of nurses, a lot of behavioral health specialists. Range of providers can be trained to deliver it. So it's really, can be delivered by a wide range of people, because that's who serves children and families out in our community settings, as you all know, right? A lot of different types of providers. And so we've tried to really make it something that is approachable to everyone. This whole model I'm telling you about, you're picturing people coming into the clinic. A lot of it we did in early childhood was home-based, because merging in with the home visiting model, all of that. Well, of course, you all know what happened. We had a pandemic occur, and we had a real shutdown of these services for families, and a real surge in telehealth and remote delivery. So it was interesting during that time because right before the pandemic hit, I had developed an online version of the family checkup, and I'd been wanting to develop something based on my research with schools. So a lot of our school providers were saying, we can't be meeting with parents and doing this kind of model. It's not feasible in a school setting. And we'd done some pretty big implementation grants here in the state of Oregon that really showed that. We actually enrolled about 40 middle schools in an implementation grant here. We trained school providers in the model. This was in like 2009, 10. I'd like to say schools from Astoria to Brookings. We had Astoria Middle School, and we had a middle school in Brookings, and everything in between. Bunch of schools in Portland. And we had about a third of those school providers be able to really implement the in-person model. And the rest of the providers, there was turnover. People were like, this is too hard. We can't do this in schools. It would be great, they said, if you had an online version. Then we could do it. We could really help parents enroll in it online and get them started. And so that kind of helped us think about, how could we develop this to something online much more scalable to, say, a whole population at a school? Or wouldn't that be great to have something online for our rural populations in the state where people are hours away from a mental health provider? So we started working on that, and we actually had a grant funded to develop it before COVID-19 occurred, and then it occurred, and we're like, oh, wow, we were timely. So, obviously COVID-19 happened, much of our mental health delivery went online, and a lot of it's remained online now. And you guys probably spend a lot of time on Zoom like I do. You've remained partly online as well. It's interesting, some of the data now, there is a higher adherence to treatment associated with telehealth, more attendance, engagement, especially for parents. Some of the barriers of driving place, parking, childcare have been removed for telehealth service delivery. There was some of the data shows there's been a 10% increase in visits after the move to telehealth. And cancellations have fallen by 13%. That's what some of our data is showing. So it's kind of interesting to think about, well, how could we pivot to providing more services to people with the telehealth model, online, remote delivery? And that's kind of what I'm interested in now. So that's what I've been studying. So like I said, we have this big grant. We did an implementation in schools. We had some challenges reaching parents in the school context. We wanted to reach rural and underserved areas. We wanted to standardize delivery with an asynchronous content model that could be delivered by even more providers. So even like if you think about a school, some of the folks providing services in school, behavior support person who is maybe a floater and goes around and connects with kids, but could also be developing or supporting parents online with this model. And we wanted to make it cost effective for wide-scale dissemination. So benefits of an online support model, it can be administered by any trained staff person. Coaching sessions can be provided for parent goal setting and practice of skills, but those can be optional and they can vary based on how much staff support there is and how much ability there is to engage parents. So in other words, the online model could be delivered with no support at all. It could just be something parents signed up for and did on their own, or it could be delivered with support from a provider where you get them set up, do kind of an intake, get to know you session, then check in, help with some of the feedback, do some goal setting, and have some light touch coaching along the way. So that's how it's delivered more as a telehealth. The content is delivered asynchronously, so it can be done at home, so parents can just do it wherever they are. And then there's a back-end support structure that allows organizations to monitor progress and track caseloads. So I'm going to show you a little bit of the online model now, and we'll watch some videos and see how it works. So what we've developed is a web-based app. It's accessed via smartphone, tablet, or computer, but most of the families we work with use it on their smartphone because another thing that's interestingly happened over the past 10 years is that most people now have a smartphone, and it is, for a lot of folks, their only access to the internet. No tablets or computers. And that was a pretty big shift over the past 10 years. So the smartphone can be a real tool for delivering services, and that's how we've used it. It's self-paced and interactive, so it supports development of positive parenting skills. Caregivers go through 5 modules, each taking about 15 to 20 minutes to complete. It's very video-based. It features a bear family, which I'm going to show you, and they demonstrate skills, and they, make mistakes as parents too, like we all do, and then they try to work it out with their kids. The video clips are very, very brief, like a minute and a half, super quick, and they just demonstrate a skill, and then you go practice with your child. The caregivers begin each module with a short survey. Now, we used our quantitative data experts to take our assessment and just distill it down to the very minimum things we really need to ask parents about in order to help them focus on their strengths and move forward. So each of the surveys is now about 10 items, 10 or 11 items, really quick. And most parents complete the survey in 30 seconds, so just like you would on a phone. And we did a lot of user groups, and you all use phones. That's what's great about this now is you can relate. When you get a survey or something on your phone, you get tired of it after about 10 items. You're like, I don't want to do this anymore. So we thought about, all of you and everyone who's a real user. You have a short attention span when you're on your phone. So we've developed it for that. It has daily text messages that encourage practice of school skills that parents can turn on or off. Now, I have to tell you, when we first started, we thought, no one's going to want all these text messages. And we were like, let's see. We took it to focus groups, and parents are like, yeah, we kind of like them. So then in our research now, we found that parents actually really like the text messages. They always turn it on, and after they get through a module and they finish, it kind of stops with those and goes to the next module of text messages. And we've had parents email and say, can I get all the text messages back? I like the text messages. So they're delivered in the evenings, like 4 to 8 p.m., like when you're struggling with, most of us have our kids at home and are like, ugh. And they just say stuff like, try saying something positive to your child right now. So you can like turn around and say, hey, you're doing a great job playing with your Legos. So that's the kind of text messages they are, just like little reminders to do something strength-based with your child. And they've been a big hit. So that was interesting. So how does it work? Well, it's the same model. It has an initial setup meeting. There's the online assessment that I've just told you about, which is super brief. And what we've done is broken it up, and it occurs before each content module. So you don't sit down and do some 50-item assessment. You answer 10 questions, then you get your feedback about positive parenting, and then you go through the positive parenting content. And then you go on to limit setting, and you answer 10 questions about your skills there, and then you go through that module, and then you get your feedback, and then you go through that module. So it's broken up, which is how you would want it delivered on a phone, right? And then with a coach, which is optional, you can check in and provide support around the feedback and specific skill training with parents through the content. Let's see. So the support contexts are like coaching contexts, as I said, that's the typical way we've tested it, but it's not necessary. It's designed to complement parenting skills that parents learn through the online program. So that's what the coaching's about. The objectives of the provider support are to motivate caregivers to engage in using the app, help create meaningful goals, and troubleshoot barriers to achieving the goals, and to offer validation and encouragement to parents as they try the skills at home. So that's kind of the goal of the role of the provider. It also provides kind of an accountability check and helps parents remember to prioritize using the skills with their child. So let's take a look at it now. I think when I switch this slide, it may start playing. So I'm going to tell you what you're going to see next. So I'm going to show you a picture of the app and then a little video that parents see when they enroll in it. So there's 4 versions of the app that we have right now. We have an early childhood version that's appropriate for parents with children ages 18 months to 5 years old. And that version has a bear family with younger children. That for the that's the host, the family host that you see. And then we have a school age version, which is what I'm going to show you the video of. And that's appropriate for kids entering kindergarten through about middle school. And that is hosted by a bear family with some older school age kids. Both versions are completely available in Spanish, and they're not just translated. They have real Spanish over, like the videos are done with Spanish actors who are Spanish speaking. So that it is fully translated, and it's been translated back and translated forward. So there's really 4 versions: early childhood English and Spanish, and school age English and Spanish. So what I'm going to show you now is just when a parent first enrolls in it, they get a little welcome video, and it kind of shows them how to use the app. And this is kind of informative because you'll see how the app is used too. See if I can make this play and if everyone can hear it. This is our true test. Okay.
As a parent, you understand the challenges and rewards of parenting. Many parents find it helpful to have access to simple tips for parenting their child through difficult times. We know that how you choose to parent is based on a variety of factors, including your culture and beliefs, your family support, and your child's personality. In this program, we offer parenting support and advice that research shows works for parents from many unique backgrounds. All parents wonder about their parenting. Am I doing what is right for my child? Is this the best way for me to handle this situation? You may be thinking about making some changes in your parenting. Good for you! In this program, a family of bears will guide you through the content. Now here's more information on how to use this program. This is the Family Checkup dashboard. It's what you'll see each time you log in. There are lots of things for you to do here. At the top, you can track the points you've earned for going through the topics and doing the activities. On the bottom, you can rate your mood each time you visit the program, which will help you think about how to apply the new skills you learn. The main menu on the dashboard lists the topics. They contain most of the content, and they also show you your progress. Now we're going to travel to the top right of this page. Here you'll find the menu. You can tap on the menu anytime to access your resources. You can also visit My Plan. It contains all of your personalized activities. You can go to the library to re-watch the videos from each topic. The list of videos will grow as you go through the program. Tap on My Account to add a personalized profile picture or update your information. There's lots more on the menu, but for now, let's go back to Dashboard because that is what you'll use the most. The dashboard contains the topics. You'll move through the content of the program from here. Here's a quick hint. You can also get to My Plan from a shortcut on the dashboard. You'll begin with the first topic. It's already open and ready for you. Notice how the arrows let you know there's more to see. To start each topic, you will answer questions to get a snapshot of how your family is doing right now. Next, you'll get your results. They will highlight your family's strengths and any areas that might benefit from your focused attention. You can use this information to guide your practice as you go through the program. You can review your answers anytime by tapping here. You'll start with the first topic. After that, you will complete the remaining topics in order. Well, that's a quick overview of the program. We know how important being a parent is to you.
Great. That worked well. Thank you so much. So that gives you a sense of what parents see and what they participate in. I'll show you a little bit more of it now, and then I'm going to show you some of the data, because you're probably thinking, does this work? Could people actually log into this? Could there be any changes in behavior? So I'll show you what we found so far, but that's coming up. Oops, moved on. Okay, so as the phone animator showed you, you go through the menu of options here, you fill out some surveys, and then you go through these different modules. We were really grateful during the pandemic that we received some additional funds from the National Institute on Mental Health to develop the first module, which you can see it's called Healthy Behaviors for Stressful Times. Now, we don't mention COVID-19 directly in that content, but it was really content that we needed to develop around coping, listening skills with your child, helping your child and you cope with stressful times, creating healthy routines, family routines that support just strengths during stressful times. So a lot of that content that is relevant to the pandemic, but it's actually continued to be extremely relevant to families just in terms of where we're at right now in terms of kids' depression and anxiety. So we're really happy that we were able to develop it. So when people start the app, they start with that content, thinking about your family routines, healthy family routines, and how you work as a family. So that's your jump start into it. And then it moves into the more kind of what you'd think of as standard parenting skills, like positive parenting and limit setting. As the app said, that gives you a sense of the brief assessment and what that looks like, and the feedback that you would get on the right there, showing strengths are in giving directions and using incentives, and some areas of growth are in thinking about what positive parenting is and using encouragement and praise. So that would be where you would focus your attention. I talked about the healthy behaviors for stressful times. As you're looking at this, you might be thinking, there's a lot of reading in this. Do people have to just sit and read stuff? Actually, it's very activity-based. We've kind of drawn from adult learning models, and we give a little bit of content, then you watch a video, and then you kind of practice the skills in different activities. So you can see one of them here, which is, what skills did you notice this mom using? And you can just check boxes. You can make different goals for your child. There's some different games embedded in the app. So there's a lot of ways that we've broken up the content to help with learning. And it is gamified, so you get points and a lot of confetti when you finish, and agencies that we did a lot of focus groups with different providers and agencies when we developed this, and they were like, there's different ways, and like a Head Start could use the points. Like if parents did the app and they got all the points, they could get a prize or a lottery for something, or gift cards, so there's different ways you could use that as an agency or provider, depending on your resources. Okay, so how about another video? Yeah, you'd like to see the bears, right? Everybody wants to see little bears. So this gives you an example of some of the little videos that we have embedded in there. This one's about selective attention, common parenting mistakes. Let's watch the bears. So I'm going to play this. Hopefully this one plays too.
Sometimes describing rules is straightforward, but watch how easily a simple statement turns into an unhelpful argument.
Can I go over to Ben's house? His brother's going to take us to a movie tonight. It's going to be fun, and I really want to see this movie.
No, you can't go to a movie on a school night.
That's a ridiculous rule. Who decided that? It's so unfair. Other kids get to go, and Ben's brother is really responsible. You're so mean.
Stop your whining. You may think you make the rules around here, but you don't. Don't be such a spoiled brat.
I hate you. I'm never talking to you again.
A better way to handle this situation is to ignore your child's strong emotional response and simply restate your rule. Ignoring can be the most effective way to reduce your child's negative reaction.
Can I go over to Ben's house? His brother's gonna take us to a movie tonight. It's gonna be fun, and I really want to see this movie.
No, you can't go to a movie on a school night.
That's a ridiculous rule. Who decided that? It's so unfair. Other kids get to go, and Ben's brother is really responsible. You're so mean.
Sorry, but that's the rule. It's a school night and it's already after 8 o'clock. You can't go out with your friends.
Whatever.
That's a nice one. I like this one because it's brief. Obviously, we all see ourselves in a video like this, right? As a parent, I mean, everyone has a moment like that with their kids. You're like, no, of course you're not going to a movie. It's 8 o'clock at night with some, no. But there's different ways to react to it. And when you react and engage, like the first example, there are a lot of the videos have a non-example and then an example of how to maybe think about doing it a different way. And this one shows an example of just not engaging with a strong emotional reaction, but just say, no, that's the rule, sorry, and de-escalating. And then if you're coaching, if you're a provider who's providing coaching, you can talk about that. Well, what does that look like in the home? How do you de-escalate an emotional reaction and help support your child and their disappointment that they can't go out? But that's the rule. And so, it can lead to a lot of different thoughts and coaching and ways of thinking about how to interact with this would be a middle schooler. So that's how the videos are used. So school age version, we talked about that. These are the different modules that go with the school age version. It covers healthy behaviors for stressful times, positive parenting, which is really I would call positive parenting the sort of core curriculum of the family checkup. Very strength-based, very focused on building positive family relationships, really targeting in, the fact that all of us, everybody, isn't as positive as they could be. And when you really start thinking about those skills and building them into your relationship with your child, we all increase our positive parenting if we become more aware of it. And that's what the family checkup sort of core content is really trying to do. Rules and consequences, and there's a module on supporting school success through healthy routines and organizing homework and school support, and then some communication, active listening, asking questions, being able to listen carefully to your child and help your child with coping and problem solving. So that's the content of the school age version. And the early childhood version, which we developed with funding from the National Institute on Drug Abuse, has a targeted module on parenting and substance use, and is really focused on supporting parents, the same kind of skills as the older childhood version, but with a little more attention to some of the risks that parents might face. So it covers positive parenting, as we discussed, same kind of framework, rules and consequences, proactive parenting, as you would use with a young child, just structuring up your environment to prevent problems. It has a whole module on wellness and self-care for adult parents, and talks about parenting and substance use from a harm reduction model. So it includes that content. I'm just going to show you a little bit of what you'd see on the back end as a provider. So if you're a provider and you're using this app in your setting, and you may use it with the in-person model, you may use it with another treatment model. It could be used as something that, say, you provide a treatment and then you have a parent use this at home to go along with it. You can see on the back end what the folks that you're working with are doing. So you get a sense, like this dashboard shows that this provider is working with 86 families who are using the English version. There's 10 using the Spanish version. And the dashboard, like here, shows a parent named Ginger Snap who's enrolled and is working on the school age version and is on module 2. as a provider, you can see all the assessment results, and you can see how people filled about and what their areas of growth are and what their strengths are. So you can use that data if you're going to call and do some coaching sessions or telehealth sessions. You can say, oh, I see you finished the assessment. It looks like you're doing really great with your praise and positive parenting, and you're thinking about working on rules and consequences. So you'll have all that information on the back end as a provider. And it drills right down to the item, so you can see exactly how they filled out the item. So let me, in the last few minutes I've got here, talk a little bit about some of our outcome data from the Family Checkup Online randomized trials that we've done. So far, we've done a couple of different big projects using the online program. So the first one was done before COVID-19, which is very interesting because it's a whole different time for the delivery of this model now. And that was a big project that where we enrolled middle school youth from 9 different middle schools across the state of Oregon, many in the Portland area, North Clackamas School District, and then some in our rural areas. We found effects there on parent self-efficacy. After 3 months, parents feeling like they had a lot more confidence in parenting their child, and we found a decrease in children reporting their own depression and anxiety 3 months later. So that was a really positive outcome because the app, as you can see, really targets parents. There's no direct target for youth. We've since got, as I told you, funded by the National Institutes on Mental Health during the COVID pandemic, and we did another big randomized trial in just as early 2021. And so it was a time when a lot of our schools were shut down or some were opening. And then we randomly assigned about 180 families to get the app or have a wait list control. So everybody got the treatment at the end. And we found that we, after 3 months and then again, still after 6 months when we did our assessments, improvements in positive parenting and proactive parenting and limit setting, improvements in reported family togetherness and co-parenting, decreased negative parenting behaviors like yelling at your child, improved parent mental health. So one of our outcomes that we've always found with a family checkup in person and now with online is improvements in particular maternal depression and decreased parent anxiety, decreased depression and stress, and improved coping. So these are some of the outcomes that were significant in our recent study of the online model. Now you might be thinking this. I often get this question, well, do people really log into this and how much time do they spend on it? I mean, you probably do things on your phone and you don't maybe do them for very long. And how can you really expect people to log into this? And we have collected data on that, of course. So we find that families will spend about 2 hours on the app total, which actually is a lot. For a web delivery like this. They averaged about 10 visits to the app. The average provider sessions, coaching sessions that we did in our research was about 5 coaching sessions, and those are about 20 minutes in length. And the average minutes on the app was about 146 minutes. And we've now found this over 2 different studies. So it's about a 2-hour intervention that people break up. You go in and you do your assessment, and then you do some positive parenting, then you put it down, then you come back to it. So you go back and forth to it, and it's meant to be used like that. This is pretty good engagement for a web-based delivery model like this. So we've been pretty happy with this. And what do parents think about it? Well, we ask parents at the end. We do some qualitative interviews and ask people, did you like it? What do you think? And here's some of the comments we've gotten. I love the text messages. They come in at times I need them. I'm reminded to breathe, offer specific praise to my kids, or do something I enjoy to improve my parenting. Just going through the modules made me want to make some changes to my routines. I've noticed I'm more conscious of my parenting day to day. It's brought positive and proactive parenting strategies to the forefront of my mind. I've been able to put these skills into action. It has actually made a big difference. Just going through the modules has made me want to make some small changes to my nighttime routines. It's been so easy to get it going. So that's some of our feedback. Oh, these kind of do a little... Hello there. So future directions. We've got some, research still in progress. We're still working with a big grant that I have where we're focused on parents of young children in rural settings who have histories of substance misuse. And that we haven't analyzed that data yet, but that we're planning about 350 families that'll be enrolled in that, and we have about 300 already going through the app. So we're looking forward to looking at that. Many of those families live in rural Oregon. We're interested in online apps as a feasible and helpful preventive tool, and our next steps are to really look at dissemination and study that. And I'm excited about that future direction. And yeah, contact me if you want to. I'd love to hear from you. And I'm going to take questions here in a minute, but I'm going to leave my contact information up. And also just make sure to do my conflict disclosure, which is I do have an outside activity arrangement with Northwest Prevention Science, and I serve as the CEO and co-founder of that. And that's the primary place that disseminates the model now to community settings, but I'm also employed at the University of Oregon. Okay. Now we have about 5 minutes left, I think, and I can take any questions.
I was wondering what the demographic information was for your average user. I'm thinking race, language, socioeconomic status, education level, things like that.
Yeah, good question. And it really varies for the different projects that I showed. And our original work, the one before the pandemic, we worked with all Title I schools and tried to target mostly parents in a low SES demographic with demographics for race and ethnicity similar to our state of Oregon. So they were we had about 17% Spanish-speaking Latino identified in that sample, and then about a pretty big percentage of what people identifying as biracial, and then mostly white. And that's pretty much, a lot of this work has been done in Oregon, so it really does follow the state demographics of our local areas. So that's pretty much the population for the online work. And then what else did you ask? About risk status, maybe?
I was thinking specifically about the app, so I was thinking like educational level, things like that. I was just thinking through families I had worked with and who the language is accessible or like the style of the language. And so I was wondering if you see trends across what type of families are engaging with the app more than others.
I think that's a great question. I know what you're getting at, and I think we did take it out to a lot of focus groups for different populations that we wanted to serve, to underserved populations, and we've done a lot of work to really scale back the difficulty of the language to make it 6th grade reading level. And when people react to it in ways and say, I don't understand this word, we try to change it. So we've tried to do a lot of work on that, because I know what you're getting at. Like, is it too academic? And so, yeah, we've done a lot of work to tailor it to what our target population is, which would be underserved, underrepresented children and families. Which is hard to do. I know what it's a challenge, yeah, especially with something online.
You may have said this, but the online version, is it just like open, like anyone can use it, or do you have to be connected with an agency that then has a coach that supports it?
Yeah, that's a great question. It's not like available on the App Store. How we're using it right now is through agencies. So, for example, that last year we trained a bunch of providers at Salem Kaiser School District, and they have a subscription to use it. That's how we're doing it. And then they're doing the coaching and support for the kids in the school. And we have some other agencies and schools coming online this year. So families access it through an agency that decides to do it. It has the support structure and then can implement it with their population.
With the outcomes, or for the parents specific, like how they engage with their kids, is that parents reporting that they are doing, or is it like observed, or it's parent self-report?
Yeah. And in the original family checkup work that I showed, like the stuff that started in the 90s, we always did parent observations. That was our big thing, and actually we were known for that. Parent observations are so expensive and so hard to do now that we really had to balance the fun part of observations, which are fun, with our desire to have a much wider scale reach, And so now we do almost all parent report for the outcomes. We do, in my research, we do also, because these are a lot of middle schoolers, youth report. So what I always think is interesting is when children report change, and they're not really, as you can see, involved, except for they're involved through their parents. So, for example, the outcomes I showed you, youth reporting improvements in depression and anxiety as a result of their parents participating. Those are powerful outcomes for us. Well, thanks. You guys have been a great audience. I really appreciate it.